wellness revolution starts now.
Welcome to today's program. I'm Dr. Steve Hotze, and we're going to talk about the microbiome, which lives within everyone's colon. Now, Hippocrates, the father of medicine, said all health starts in the gut. And we're going to talk about why your microbiome, why the bacteria makeup of your large intestine has a profound effect upon your health. We call the bacteria within our large intestine, and by the way, it lives in the large intestine. It doesn't live in the small intestine. That's sterile routinely, although there are some diseases you can get an overgrowth of bacterial, call it small intestine bacterial overgrowth, which does happen when people get leaky gut syndrome. But in general, all the bacteria within the intestinal system is located in the colon, and our body has 40, 50, 60 trillion cells, and literally in the gut, there are 40 to 60 trillion bacteria, and there are different types of bacteria. They're called autochthonous or commensal bacteria, and they're bacteria that we need in order to maintain good health. Literally, the bacteria in our gut produce neurotransmitter precursors or neurotransmitters that literally affect the way we think and the way we feel. You've heard the old expression, I got a gut feeling about this, or I've got a bad feeling in my gut about this. It's interesting that people have, in colloquial expressions, talked about the gut and its effect on the way they think or feel. Just by that saying, it's got a gut feeling about this. Well, what causes that is that the bacteria within the gut, and there are numerous bacteria, literally thousands and thousands of different types of bacteria. Primarily, we think of the bacteria bifidobacteria, lactobacillus bacteria, and bifidobacteria and Bacteroides bacteria. And they all have different subclasses within those groups. These are the normal, healthy bacteria that help us digest our food and produce the very neurotransmitters that enable us to think or that enable our body to function properly. The neurotransmitters that are affected by the gut microbiome are serotonin, dopamine, norepinephrine, GABA, glutamate, among others. And the bacteria literally will secrete precursors of the neurotransmitters, which are then absorbed through the intestinal lining and converted in the body to neurotransmitters, or they literally produce the neurotransmitters themselves that are then absorbed into the body. So it's important for us to have a good and proper balance of healthy bacteria within our colon. And there's some things that disrupt our bacteria. And the most common disruptive force in the gut is antibiotics. And of course, I came out with penicillin in the 1940s. And then ever since then, it seems like conventional doctors have, and it's been documented, overuse antibiotics to try to address a plethora of problems. You have a sore throat, you got an earache, you got a cough, congestion, maybe you got the flu-like symptoms. They'll always just throw antibiotics in. They're going to throw antibiotics at it. And those antibiotics are meant now, you may need the antibiotic. You may have a bad sinus infection, you may truly have pneumonia or bad bronchitis that's based upon a bacterial infection. And the antibiotics will kill off the unhealthy and dangerous bacteria in your body. But the antibiotics go into the gut too, and they kill off normal, healthy bacteria as well. And when that happens, we all have a little bit of yeast, which is in the fungus family that lives within the colon, and the yeast is not affected adversely by the antibiotics, and those yeast overgrow. Women oftentimes will get female yeast infections. In fact, in the old days when I was in a more general practice, and before I did allergy treatment in our practice here, women would always tell me whenever I would give them an antibiotic, "Oh, doctor, you've got to get me some vaginal cream because those yeast. I'm going to get yeast. I can always get a yeast infection." And I was commonly giving some sort of cream or ointment for the women to use to help prevent that from happening. Now, women can get vaginal yeast infections that can be cleared up, but because the inner lining of the vagina has good, healthy bacteria on it as well, that gets killed off by the antibiotics. But that doesn't treat the colon when the good, healthy bacteria are killed off. So yeast overgrows in the colon, and yeast are toxic, and they're made in the spore form, and they're made in the spore form, and then the mycelial form that bores right into the intestinal lining, and the yeast will produce toxins that quickly pass the lining of the colon and get into the bloodstream, and these toxins depress the immune system, adversely affect the immune system, and make it more susceptible to infections. You get on this cycle of illness, especially if you have allergies and you got chronic drainage. That's just a culture media for bacteria. And so what happens, you take the antibiotics, kill off good, healthy bacteria, yeast overgrows, yeast produces toxins, get in the bloodstream, depresses the immune system, you get more infections, you get more antibiotics, you get more yeast, and it's this cycle of illness that people go on. So especially among allergy people, guests that we have or patients that we've had in the past, they would come in and they would be on antibiotics several times a year. And that caused them a host of health problems, because when the gut is unhealthy and you have unhealthy bacteria, you cause inflammation in the lining of the colon, and molecules from food can eat, and other toxic molecules can easily cross the gut lining into the bloodstream. And the immune system then reacts to that and makes antibodies to these various chemical products and food products that are getting into the blood system, which aren't meant to be there. And they oftentimes cross-react with other portions of our body. So people can get autoimmune disease, where they begin to make the antibodies they're making to the various toxins and food additives that cross the gut blood barrier. They make antibodies to that. They cross-react with other organs in the body, like the thyroid gland, or maybe the liver, or the kidneys, or the joints. So they get autoimmune diseases, and those autoimmune diseases cause a host of health problems. And that's all caused because of overuse of antibiotics and a loss of good, healthy bacteria in the gut. So what do we do about that? Well, what we do is we want to replenish the bacteria in the gut. Remember, when the bacteria in the gut are imbalanced, we have unhealthy bacteria in the gut. That's going to affect, because of the lack of production of certain neurotransmitters, it's going to affect brain function, the way people think, the way they feel. It can lead to depression. It can cause inflammation in the arteries. It can cause joint muscle aches and pains. It can cause skin disorders like psoriasis and eczema. And it can cause a host of various illnesses that are all related to unhealthy gut. So we want to replenish the gut and put good, healthy bacteria in the gut. And we take probiotics to do that. And probiotics come in another number of different brands. But what you want to look for is make sure you have bifidobacteria and lactobacillus bacteria. And these are live bacteria. They're in powder form. You can get them in capsule form or in powder form. And if you take them in powder form, you mix them in a glass of water and you drink that down. And that can be helpful, even better than taking them in the capsule form. You want to take them on an empty stomach, because if you take your probiotics with food, then you have a lot of acid production, and that can kill off some of the bacteria. So you replenish this bacteria, and you put it in your to recolonize the gut with good, healthy, commensal, autochthonous bacteria that will balance out and get rid of the bad bacteria and get rid of the yeast overgrowth. At the same time, you should take something to kill yeast. And we use nystatin that kills yeast in the spore form of the colon. It's not absorbed systemically. And then we'll use fluconazole to kill yeast that bores into the walls in the mycelial form. And that will get rid of the yeast, and then we recolonize the gut with the probiotics, particularly bifidobacteria and lactobacillus bacteria. Now, you can also get these bacteria in cultured milk products, buttermilk, yogurt, sauerkraut also contains it. Many of the foods that are fermented contain that bacteria. And you can eat those and you can recolonize the gut through proper eating of proper foods, or you can take supplements that are probiotics. Now, the bacteria in the gut also need to be fed, and they need good food products. And what we call these are prebiotics. Prebiotics would be vegetables, broccoli, spinach. It would be grain products, whether it's wheat or oats, or it could be fruits, various fruit products, and then other particular products like inulin, which is contained in these various. By the way, beans and legumes can also be used. And these prebiotics are fiber, and the fiber is not digested in the stomach. It just doesn't digest well, so it gets into the large colon. And there the bacteria feed upon this. And these various food products contain inulin, inulin, and that inulin is a food product contained in the prebiotics that the bacteria feed on. It keeps them healthy. So, and you can also take prebiotic capsules that are mixed with the probiotics, and you may take bacterial probiotics with a good, healthy bacteria that also contains inulin, which is the product that's contained in these various food products that are roughage. That's what they live on. And so you can take that in a capsule, and that'll be helpful. But all this is important for you to have a good, healthy microbiome in the large intestine. Your health is going to be based upon that. By the way, and I didn't mention this really, but one of the common features we see when people get yeast overgrowth is they get bloating, belching, gas, and indigestion. And they get that because yeast grows on sugar. So that's one thing. When you have a leaky gut syndrome and when you've got an overgrowth of yeast, you want to cut out your sugar, and that's cutting out that would be cutting out bread products, wheat products, corn products, potatoes and rice. All those are simple carbohydrates that immediately convert to sugar when you eat them, and then yeast grows on sugar. And if you've ever made homemade bread, you get the flour and you put water in it, you knead it, and then you want to get it to rise. You take Fleischmann's yeast, you put it in a glass of water, sprinkle a little sugar in it, and it foams. Well, that's what happens in the gut. When you have yeast in the large intestine, you get cravings for sugar. You eat sugar, you get bloating, belching, gas, indigestion, diarrhea. And you go to the doctor and he says, you got irritable bowel syndrome. We're going to give you Nexium, or we'll give you Prilosec, or we're going to give you some drug. And without addressing the underlying problem, which is a microbiome that is unhealthy. We want to get your microbiome healthy in the large intestine. And again, we do that by killing off the yeast and eliminating sugar from the diet, and by taking probiotics, good, healthy, commensal bacteria that your body needs to make neurotransmitters and the various, and to keep the walls of the intestine healthy. And then we take probiotics to feed those bacteria. In doing that, you can ensure yourself that you can be healthier than you are. Many problems start right in the gut. As Hippocrates, the father of medicine, said, and that's true, and it's becoming more and more obvious now to people. I'm just thinking about this. I was reading that people that have Alzheimer's disease, Parkinson's disease, multiple sclerosis, and other neurological disorders, when they check the microbiome in the gut, there's certain discrepancies and certain abnormalities that are common in those various diseases. So there's potential that simply by correcting the microbiome, we can help people overcome some of these diseases. I'm not saying it's going to be the cure-all for everything, but it obviously has an effect on the way people achieve health and wellness. So I want to encourage all of you to consider this very closely in your eating habits. You want to eat to live. You don't want to live to eat. And the way you can do that, cut out your sugars, kill off the yeast, take probiotics and prebiotics, and see if that doesn't help relieve many of the problems that you're experiencing. I'm Dr. Hotze. Thank you for joining us today.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.